And joining me to talk about COVID-19 and distribution of vaccines is a public health physician, Tuyi Mebawondu. Good to have you join us, Tuyi Mebawondu. Now, we just looked at we saw how China is distributing these vaccines and how many people have been vaccinated in some areas. But let's bring this back to Nigeria, where the federal government has said that this vaccine will be distributed according to the number of cases or infection rates in states and regions, and it put Kano ahead of Lagos with 3,557 and Lagos with 3,131. But when you look at the confirmed cases, Lagos is number 1 and Kano is number 8. So help us understand what is infection rate and how these vaccines are being distributed.
It is important that the Director General or the head of the Nigeria Primary Healthcare Development Agency should tell us the metric behind the distribution. Because if you want to look at it, the focus should be how to beat down the fatality from the infection, reduce the infection rate, and ensure that as much as possible you achieve herd immunity. Now, Lagos, Federal Capital Territory, Kaduna, Plateau, Oyo, these are the leading states with the largest number of COVID-19. In such a way that if you can deal with those COVID-19 infections in those states, you've probably done well for the whole of the country. I was expecting that the focus would be on those states with the highest number of positive cases. Secondly, if you're looking at the group that's actually that's supposed to take the vaccines, we're talking about the medical community. We're talking about the prisoner. We're talking about the people in the markets and old homes. You will find out that if we look at the medical community, for instance, as much as 60% of the health workers in the whole of the country are located in Southwest. I mean, if you want to consider that, then it comes to the fact that you should focus on Southwest to give that vaccination before you consider any other places. If you look at even the population at the market, available, you see that even Lagos has a lot of transnational markets, Yes, it's also in Kano, but you see that of Lagos being more, attended to in such a way that you have to actually look at those levels to deliver those vaccines. We need to understand the metric clearly. But if you want to beat down this virus, if you want to achieve the vaccination, if you want to achieve the vaccination, you have to get your metrics right. You cannot just wake up and say that, listen, I'm going to introduce the politics of vaccination into the control of COVID.
So the federal government also said that all states will receive an initial 4,000 vaccines, 4,000 for every state first. And then there is also the part where we're going to achieve 40% vaccination by 2021 and 70% vaccination by 2022. Doesn't look like we're treating this as a public health emergency at all.
Precious, look, listen, 4,000 vaccines for each state. To treat how many people? Okay? Now, the critical point for you to achieve herd immunity and be able to beat back this virus is that you must achieve as much as 70% vaccination. Okay? Now, if you're giving 4,000 vaccines to who now? I can tell you the vaccines will end up with the politicians, okay, who will now give it to their wards and relatives, and then the rest can then go and sort themselves out. We've not actually sit down and consider the thoroughness of this disease. We're not looking at the dynamic of this disease at all. We're not looking at the hurts that disease is inflicting on the nation and our psyche in such a way that we can deploy this vaccine appropriately. Now, if they're giving 10,000 or 3,000, you said, or 4,000 to states, that means it's for 2,000 people now because you need two doses. Okay? So 2,000 people, how are you going to start, for goodness sake? So we're not... Sincerely, we're not, and we need to say this. We need to say that we need to stand up and be able to rearrange this vaccination appropriately. Now, one of the works that needs to be done is to actually deal with those doubters. There's a high level of vaccination hesitancy in the country. How do we deal with those things? The narration must continue. We must keep discussing that so that, indeed, even when that 2,000 or so people comes up, we can easily get the vaccine. And then we can encourage uptake of the vaccine for more people.
As we speak, there is a statement now from the Minister of Finance, Zainab Ahmed, that no provision was made for the acquisition of the COVID-19 vaccine in the 2021 budget. We understand that this virus was first detected in Nigeria in February 2020, and now we're in 2021, and yet we do not have provision for the vaccine in the 2021 budget.
Now, so if there's no provision for the vaccine, probably they're going to bring supplementary budget to bridge the gap. If you have to rely on COVAX or WHO, there's a maximum number because we are not the only country that cannot afford it. In fact, in reality, when they look at Nigerian dynamics, they feel that you should be able to lead the pack and, you know, show leadership in terms of budgeting, controlling this infection in Nigeria. Let's face it, 20% of all Africans are Nigerians. So where are you? So in a way, so if there's no budget, COVAX, how many can they produce for you or give to you free of charge? Little. Now, even if you're not budgeting, the buying of vaccine is one thing. You have to budget on human resources and support structure to move vaccine to vaccination. So if you say you are not budgeting, then what are we talking about? We hope that they're going to bring supplementary budget to deal with those things. We shouldn't doubt that.
A lot to talk about when it comes to the preparedness of Nigeria in tackling the outbreak of COVID-19 here in the country. But I'm afraid we do have to leave it there. Public health physician Tuyi Mebawondu, thanks for talking to us.
Thank you, Precious.